One of the common questions that we get during the consultation is, can I have my liposuction without general anesthesia, without putting me to sleep? And the answer is yes. But how do we do it? But before getting there, let me just say a little bit of the history here. This is a procedure, when we do a liposuction, this is a procedure in which actually the patient has to be pain-free. I cannot do a liposuction, the patient is screaming and having pain. It's impossible, right? So it's very important that there is the right sedation and the right anesthesia, which I'm going to explain that in a second now. Now, compared to other procedures, let's say when we're doing something on the face, sometimes we just put a little bit of cream and it's in and out, and the patient actually it's able, let's say when we put fillers on the face, we don't use all this solution or numb the whole area, we just use a cream. So it is a procedure in which you need to really be pain-free, right? Because if you're having pain, then it would be really difficult to perform. Now, one of the things that I like a lot when I do it in this way is that I'm thinking also, okay, what is the worst thing that can happen? For example, if somebody have been cases in which a patient on the general anesthesia, the instrument, the cannula, had gone into the lungs, right? But nobody knows because patient is put to sleep, is the anesthesiologist who might detect that the oxygen goes down or something. So one of the things is that, let's say, God forbid, and I go into an area that I shouldn't be, the patient is going to move, and I'm going to stop too at the same time. Or if the instrument goes down into the intestine, which is very rare, but have been reported too, on the general anesthesia, in this situation, if the patient is done in this way, that I'm going to describe now in a second, without general anesthesia, the patient is going to wake up. So that's a good thing, because once the patient woke up, that indicates that probably went to an area that I shouldn't be, right? Or the patient is having pain suddenly, or wake up like this. So that's very important in regards to complications. But how do we do it? First of all, we use a light sedation medication to make you relax, and actually we give it by mouth. The patient has an IV, an intravenous a line, but in reality I prefer everything to be used by mouth. So during the procedure the patient is relaxed, actually goes to sleep, like when you're taking a long nap, and some patients actually start talking during the procedure, we have conversations and so forth. Now, how do we make the area numb? Okay, we use something called the tumescent fluid, which contains lidocaine, epinephrine, bicarb, but the main ingredient is actually the lidocaine. Lidocaine is the substance, probably everybody's familiar with lidocaine. When you go to a dentist and they do a dental block, or if you have a cut, you go to the emergency room, they put a little bit of lidocaine to numb the area so you can do a suture or whatever procedure. So that's the main ingredient. The epinephrine, actually, what it does, it causes vasoconstriction, tightening of the blood vessels. So in that way, we minimize the bruising that sometimes can happen after or during the liposuction. And then we use a technique on how to put that solution, because this is very, very important. How do we put the solution to make the area numb? So this is very important to have the patient actually properly numb, and then the doctor being able to perform the procedure. This is one of the situations in which the techniques plus the machine help us out. In this situation, I like to do something called the body jet liposuction or water assisted liposuction, in which basically it allows me to numb, let's say, an abdomen in 10-15 minutes. One of the ways that I describe this to my patient is the following. Imagine that you go to a nice hotel, you go to take a shower, and remember these fancy showers, now you can get a shot like this, or you can get 2 shots or 3 shots, or spray in different ways. So that's one of the things, like in this situation, with the technology actually helped me out significantly, because I can go and put the solution, let's say like this, like my fingers, 5 fingers or 3 fingers, or only 1 shot, depending on what I'm going to be doing. Like I said before, There is no intubation. So one of the main things actually that is happening because of the pandemic that is happening right now, some of the societies are recommending that no general anesthesia being performed at all, or minimize the use of general anesthesia if possible, because of the virus, can transmit to others, or from the personnel, or from the patient, and so forth, and actually can go directly into the lungs. The other thing also is that when we perform the procedure without general anesthesia, I'll be able to move the patient anywhere I want. It can be flat, in the back, can be in the belly, it can be on the sides, on the left side, right side. So I'll be able to do a very nice sculpting and give me the opportunity actually to work or perform myself better into that patient, because I'm moving the patient constantly. Plus also this is very important, again we are talking about complication, one of the complications with general anesthesia that can happen theoretically, because of lack of movement, the blood doesn't move too much, so patients are more prone probably to develop blood clots. And if you have a blood clot on the leg, the blood clot actually can go into the lungs, and there is a condition called pulmonary embolism, which is very fatal. So the point here really is my philosophy is safety, 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 safety. So by going back to the result, to the outcome of the liposuction, I feel it's very important to perform the procedure in such a way, because it will give me more room actually, because I'm moving the patient in any way I want. Plus also probably the movement, the patient actually, if they decide to, I don't know, they need to urinate, patient urinate, or if they want to take a break, they take a break. So these allow us actually to probably change the paradigm of how the liposuction is actually performed. The other thing also is that the patient usually they go home, we ask the family member or a friend to be with the patient for at least 24 to 48 hours. Right, this is very important, the follow-up, and also follow up that patient. But like what I'm going to say now, this is nothing new. If somebody goes on the general anesthesia, the recovery on that patient is going to be longer, right? Because intubation and all that, and if there is any minor complication, pulmonary complication, or the patient is not really too healthy and underwent general anesthesia, then probably the chances are higher, or if the patient is obese, super obese, or let's say BMI more than 35, more than 30, all right, more than 32, 35, then obesity is a risk factor for having more complications, not only for this procedure, but overall, any operation. Well, I hope that this video was helpful. Please wait for next more videos and subscribe to our page too. Thank you.